All right, we are broadcasting. Let me. Hello, everybody. Come on in the room while I'm trying to. We'll wait a few minutes while everybody is coming.
I'm at home, so I'm going to make sure everybody knows.
All right. And I might my internet's been a little, I don't know, every time I go live, it gets a little weird. So if I say I can't hear you, I'm going to ask the audience because the last time everybody can hear my guests just fine, but I wasn't able to hear them. Hello, whoever joined, just put your name in, and so we can welcome you into the room. And we'll get started very shortly. So it's a pretty day out here. How is it over on your end?
It was nicer yesterday, but it's not bad. It's like high 50s.
Okay.
It was in the 70s though.
That's what it is here. It's been in high 60s, low 70s. So
yeah,
I'm excited about that. All right. So we're not going to delay. We're going to get started. We're going to get started. So welcome to the Empowerment Firm Chat. Let's chat. And we have here our guest, Dr. Yolanda Mines. So a round of applause. Thank you for being my guest today. So we're going to get started. And I just want you first to introduce yourself to the audience and let them know who you are and where you're from.
So thank you for having me today. I am originally from Warren, Ohio, grew up in California, and I practice and live in South Carolina. I've been here in Columbia since about 2004, so for a while now. I am a former Navy member. I joined the Navy right out of high school and got to travel the world. I was stationed overseas for a little while, and then stationed in Norfolk, where I met my husband, and then relocated to South Carolina. And I, after I got out of the military, tried to figure out what I wanted to do in school. I was actually in IT in the Navy. And I figured out I did not like doing that. And so I realized that biology was what my favorite subject. That's what I loved doing in high school. And so that's what I decided to major in college, and then realized I wanted to go into the medical field. And then went to med school. And it actually wasn't until I did my OB-GYN rotation in med school that I realized I wanted to be an OB-GYN. I initially thought I wanted to be a pediatrician.
Wow.
So, yeah. So I'm board certified, and I have been practicing in obstetrics and gynecology since I completed residency in 2015, and love it. I do everything from delivering women to just doing gynecological care to doing surgeries like hysterectomies and things like that as well. So it's nice to be able to deal with women at all stages of their lives, from teenagers to women in their 70s and 80s.
That is beautiful. I love it. Especially you find your passion. I always think it is a beautiful thing when people find their passion, because their passion will, it basically is their motivator to bring them into the success that they want. So, and then it helps everybody else around them because you're so passionate about it. So thank you for what you do. So what inspired you to become an OB-GYN?
So for me, I knew that I wanted to be an OB-GYN actually the first day of my rotation in med school. So I was on labor and delivery. I was working night float. It was, what should have been a very strenuous rotation. But just that feeling that I got, like you said, where I did the first delivery and just started doing things in the clinic and just started seeing the variety in the field. It was just always exciting. It was always doing something new. Being able to have someone come in with a problem and being able to do surgery and immediately be able to help them with their problems, or, even medically being able to help, was rewarding. And there's still no feeling like delivering a little one also. But yeah, it was that feeling, when I did the rotation, like, this is what I'm supposed to be doing.
Awesome. Okay. So, active duty, well, I'm going to go back. As an OB-GYN, that works in the, I'm sorry, let me slow down. As an OB-GYN that works in the civilian sector, why is it important to be aware of your patient's military status?
So, especially in the area that I am in, we have Fort Jackson here. So, it's a very large Army installation. So, we definitely get a lot of people who are stationed at the base, or we get a lot of patients who are veterans or dependents of members that are currently active duty. And so it's just important to make sure that, number one, that all of their GYN needs have even been addressed. A lot of times they haven't been addressed. So things like endometriosis, fibroid uterus, things like heavy menstrual cycles, which can have a huge impact on a person's life. Things like contraception, which is really important, just to prevent unplanned pregnancies. Testing for sexually transmitted diseases, which can cause a lot of negative outcomes in the future. A lot of that stuff isn't always done previously. You can't assume that it's been done in the military. And so it's really important to know where that care was. Also, just making sure that we're really paying attention to things like depression, to anxiety, to PTSD, any previous, histories of sexual assault, or even, things that may have been uncomfortable, sexual harassment or anything like that, that may still be affecting those members, are important.
Yeah, awesome. Yeah, because we're going to touch on a lot of what you just said. So, this is going back to what you just spoke on. So, what is it about the military environment? Actually, do I want to go there? No. So, active duty and veteran women face unique healthcare needs related to their military service. What are some of these healthcare and particular needs?
Well, definitely, there are higher rates of mood disorders, so of depression, anxiety, of PTSD as well, especially with people who are stationed in war zone areas or in combat areas. So it's important to make sure that that's screened for, because that can have negative consequences in terms of health for years to come, and people don't always come forward with that. And then also just being very specific when screening for any types of abuse that may be occurring, not just with significant others, but even by other members of their staff that they're working with as well, is important too. And it may seem like it's normal to someone, who's currently in the military. And so just being able to ask that and open up the door to say, hey, this isn't normal. Are you experiencing this, is important. And then another huge thing also, I kind of touched on it before, is really contraception as well. So a lot of people don't know that as a physician, when we finish medical school in the civilian sector, we go to residency. And you practice during residency, but you are supervised. And then when you finish residency, you're board certified, and you practice in your specialty. Well, in the military, there can be a gap between physicians who finish medical school and actually start residency. So there may be 1 to 2, maybe even 3 years where they're practicing general medicine, they're physicians, but they haven't gone through a residency in a particular specialty. And that tends to happen a lot on ships, overseas a lot. You can see that. And there's no way for you to necessarily know. And the reason that I say that is not because the medical care isn't going to be adequate, but they're not specialists. If you go to get an annual exam, they may not know to tell you about all of the types of birth control. They may not think, a birth control pill isn't going to work for this person who is in a combat zone, who is working different shifts and can't take a pill at the same time or doesn't have access to a pharmacy. They're just not going to think of those things. But if you have an unplanned pregnancy, it's now derailed a lot of stuff. It's now changed the trajectory of your career. It's life-changing for you. So, I think that screening, of course, for abuse, screening for mood disorders is huge, but I also think that family planning is huge. And I get a lot of patients that are getting ready to enter the military. And that's one thing that we always talk about. We talk about long-acting forms of birth control, things where it's placed, you forget it. You don't have to think about it for 3 to 5 years. Or we talk about things that might not work in certain areas. So I think that that's important too.
That is great information because I did not know that. That's great information. And you touched on this as well, but what is it in a more specific manner about the military environment that increases these issues?
So in terms of a lot of the abuse or even the PTSD, of course, being in a combat area or in a war zone, being exposed to traumatic events, that can increase the risk of mood issues or PTSD. But also, if you think about just the environment of where you're living, you're living in close quarters in the Navy on a ship where things can occur. Um, People may not always feel comfortable talking to their chain of command about what's going on. It may be happening to multiple people around you. So you think, okay, well, hey, this is normal. When you're stationed overseas, the same thing. There's such close living quarters. You're with these same people all the time. And so it can be hard to come forward to say, hey, this is happening to me.
Yeah.
And so I think that definitely prevents a lot of people from coming forward at the time that things are happening in the military, no matter what the branch is. And, from the family planning standpoint, like I talked about, if somebody is overseas, if they don't have access, to a pharmacy all the time, or, if you're out to ship, if you're, out to sea, you for 6 months could be gone. I mean, are you going to have access to a shot if you decide to get a shot? Or, these are things that we have to kind of think about that a physician won't always bring up. And so, things that you have to kind of work through. So yeah, it's limited medical care when on deployment, and then just living in close quarters in remote areas as well also facilitate that environment of just not feeling comfortable speaking up all of the time.
Yeah.
If it's a superior, of course, there's always, am I going to be believed, or does anyone believe that? So,
we hear a lot of that. I think with everything coming into more of the spotlight now, like more of the civilian sector, it's like, wow, but people that have been in know that it has been, a perpetual problem. It's pervasive. It's sad, and more, in some branches more than others, but it is a very pervasive problem that needs to be dealt with. So that's something that we need to speak on a lot more. So you spoke on this, but I want to again feel like we're kind of meshing, so that's good. But I want to hit on this a little bit more. At the VA, military sexual trauma screenings are mandatory. They're mandated to be given by the healthcare providers. As a civilian practitioner, are these screenings also mandated? I know you say you do them, but are they mandated? And once you are aware of the patient's military status, do you give them?
So no, they are not mandated.
Okay.
I will say that although they are not mandated in both the primary care setting and as well as OB-GYNs, because we are often the primary care for a lot of young women, it is for all of our patients usually part of our screening. But the actual standardized questionnaires that the military or that the VA uses is not something that's readily used on the civilian side. I will say that. So I ask everyone regardless of their military status, but I would say that, you know, it is important to make sure. I mean, I definitely don't know, you know, what every single practice is doing, but I think that it is something um, that more people in the civilian sector need to be made aware of, so that they are asking specific questions and just making sure that their patients feel comfortable speaking up.
It's so true because I was reading and I try to do like stat checks and how the woman, the increase of women going into the military, of course, will increase the women coming out and just going to, especially with the VA, because they give you a choice to, especially if they're backed up, will try.
Hmm.
They'll give you an option to go to a civilian doctor, and with that number increasing, that is still very important to see where these women are at when it comes to, well, it's all across the board, but mental stability or having
Hmm.
um, those identifiers of PTSD and MST. So that's the actually is leading into the question that I'm about to ask. So, what are some of the effects of MST and PTSD on a woman's body and reproductive health?
So it of course is a huge stressor. Stress in general, just talking about just the reproductive health, can cause irregular cycles for women who are trying to conceive. It can affect that as well. For women who become pregnant, and we do have several patients, PTSD, especially in women who have had history of sexual trauma, can make that process really difficult. It can make it hard to have vaginal exams. It can make it hard to even think about the process of delivery. So something, you know, that they should enjoy, they're fearful of, you know, they're dreading, you know, different exams. And so that's definitely something that we have to treat aggressively, that we try to treat aggressively before
Mhm.
pregnancy. But during pregnancy, um, definitely can see worsening of those symptoms. Worsen, even if it's not sexual trauma related, just with PTSD, also because in pregnancy in general, any underlying depression or anxiety can be heightened. And so even with PTSD, we can start to see patients get more invasive dreams and
Mhm.
just have an increase in their symptoms as well. So definitely can carry over into reproductive health. And then just in general, from a medical standpoint, if these patients are not treated, if these issues haven't been identified, they haven't gone to the VA to get treatment, a lot of them just don't go to the doctor. They just don't get preventative health care, period. And so then you have all of the complications that can occur when we don't have preventative health care. So from my standpoint, you know, we can have increases in, again, unplanned pregnancies. You can have increases also just in cervical cancer and breast cancer and a lot of things that we can prevent. But with no medical care, it's kind of hard to prevent that. And then, of course, we already know the increased risk of suicide as well when these things aren't treated.
Yeah. What does treatment look like? I didn't write that down, but I wanted to ask.
Mhm.
Um, you're saying the aggressive treatment. What does that look like?
So personally, I don't treat them, but we do
Yeah.
facilitate them getting treated. And I can say that it is multiple specialties that involve. So counseling is huge. Psychiatry also is huge, and just prescribing medications and things like that. But both of those together are huge, and usually the primary care is also involved as well. Um, some of these patients don't always stay under the care of a psychiatrist the whole time, but their primary care will monitor symptoms and then get them back into psychiatry for more aggressive treatment if needed. But the counseling and the psychiatry piece is huge. Like we need both. Can't
Yes.
have one without the other.
Yeah.
Have to have both.
That makes sense. I keep on different because I know I gave you questions, but quite a subject matter came up. I remember I did a master's degree in law, and we were talking about just the VA in itself. A lot of women don't like going to the VA because it's kind of just another branch of what they've been at, especially if they have trauma. And the VA sadly hasn't done a really good job at dealing with a lot of women's treatments. For instance, I hear, and I thought it was just, don't want to say one off, but I hear a lot of women go in and say that they either been sexually harassed at the VA or disrespected by a doctor at the VA. So with that, I don't even know how we would capture between the civilian world and the military world when that cutoff is right there. I guess that is a question that we all have to come together, because women are just discouraged all the way around. It's like, I just got at this traumatic situation, or I'm living with this traumatic situation in a very, this entity that was here, placed here to help me with my medical needs and my psychological needs, and all of that is continuously victimizing me. So I feel like we can, I don't know if you want to speak on this, how you can branch out and make that bridge between there. How can a bridge be made in that type of situation between the military and the civilian sector?
Well, I think that I would hope that that's not something that's rampant in the VA. I mean, I don't know for sure, but I would hope. I'm going to assume that it's not rampant in the VA, and I'm going to say that first things first. There are some checks and balances in the VA system, and it's not like active duty where you're so enclosed and you're fearful because your chain of command, is right here in front of you. So, there are patient advocates, that you can definitely speak to if something like that is happening. And I have a lot of patients who were at the VA, and I don't know how all of them are set up, but the one that we have here, you have different teams, and there's a women's health team, and that's your primary care if you choose that, or you can choose just a general primary care track. But either way, you can request a civilian sector. So I have a lot of patients who say, hey, I just would prefer, they tell the VA, I would prefer to see this person in the civilian sector, and they're able to come and see me. So I think just if it really is not helping with, the healing process, just getting out of that system may be something to do. And just requesting to be seen in the civilian sector. I have a lot of patients who've done that. I don't know, if it's going to be something that's short-lived, but with the access to care, I think that's something that's going to stay around for a while, quite honestly, because we just don't have the access to care in the VA. So that's what I would suggest. I think that it definitely needs to be reported, because there's going to be someone behind you, if this person is doing this. So I would still report it. But then I wouldn't keep going there. I would definitely request, to be moved. Yeah.
Yeah. Sadly, that's not that situation, but I had a weird situation at the VA in Phoenix where a guy literally followed me around to all of my appointments, all the way into a pharmacy, which was just really creepy. But like I say, I'm hearing more since the topic is coming up. Having more issues at the VA, and it's like, I don't want to deal with this knowing that I have other trauma. So it's nice to hear that. I know that I don't know all the options, but it's good to hear that they can actually just investigate or do their due diligence to see if they can just go to civilian track if they're comfortable with that. So thank you for that information. So we're getting ready to wrap a few of the stuff up. So the one question that I think is very important is, as the number one steward over our own healthcare, what are some of the best practices you recommend for optimal health for women's health?
So I think first and foremost, if you know that you are struggling with depression or anxiety, or if you know that you've had some type of trauma in the past, some type of abuse in the past, that is affecting you. I think being able to just be brave and ask for help is huge. If you ask for help, people will listen, and you don't have to feel like you're the only one. So I think definitely not being afraid to ask for help is huge. I think preventative care is huge. It's huge. It's so hard if you don't have that preventative care and we're trying to take care of things afterwards. And so really staying on track of things, making sure that as a female that you're getting your annual GYN exam, making sure that if you are sexually active, that you are getting sexually transmitted, disease testing regularly, making sure that if you do not want an unplanned pregnancy, that you're taking control of that and finding a birth control option that is going to work for whatever setting you're going to be in. All of those things are huge because they can change the trajectory of your entire life. So those are the biggest things, is just being proactive, getting help early, staying on top of preventative health. Your general practitioner, that's with you. If you're stationed overseas, they may not realize that it's time for your pap smear. You may have to say, hey, you know what, it's been, this amount of time, it's time. Or speaking up, even if it's just, something as simple as, hey, I'm having a lot of bleeding during my cycles. I don't think this is normal. Can we get this evaluated? Because I can't tell you how many patients we've admitted to the hospital and we're having to give blood transfusions, because they didn't say anything. No one helped them, until it was too late. So just knowing your body and not being afraid to speak up when something isn't right, or if something isn't being addressed when you think that it should be addressed, just bringing that up.
Yeah, that's good. That is good. So I'm going to ask the audience for any questions. And if anybody's typing, where could people contact you? I'm going to put it, as you're talking, I'm going to put it down below in the comments because I want to do it as well.
So I think you have the phone number that'll be there. The easiest thing to do, if you are in the area also, is to go to Prisma Health appointments, and you can just type my name in, and that'll come up with a bio, introductory video, but you can book appointments there as well. I'm on Instagram as well, and sometimes put things on there. My Facebook stuff is private, but my Instagram is easy. It's just my name, Yolanda Mines. But in terms of appointments, it's Prisma Health appointments. Just Google that, and when that comes up, putting in my name is the easiest way.
Okay, we have a statement. There was basically saying sexual harassment at the VA. We need more advocates. MST triggers in VA experience. Ugh,
yeah,
that's
terrible. That opened my eyes because I honestly didn't realize that that was going on. So yeah, you can request to just be seen in the civilian sector. I have people, do it all the time. They say, hey, you know what? Get me a referral to someone in the civilian sector. And I would do that. I would still report it because it's not going to be, no one's going to know it's an issue until we report it. Yeah. So I think that's important, is that we have to get these things documented. But after that, that's the thing about at least being outside of the military now, you have options.
Exactly. Well, that's good. That's why I like to have these discussions, so we can bring awareness, but we do need to advocate for the needs of, all people, but specifically we're talking about this topic in this demographic. So veteran women, they feel like their voice has been silenced in a lot of areas. So just to let their voice be heard and to advocate for their needs. So thank you so much for your time. I know everybody's time is precious, especially around now with your family. So I appreciate you. And any last statements that you can give us, or any Any words of wisdom before we go out?
Well, I think I pretty much touched on everything, just be an advocate for yourself and don't be afraid to speak up. And actually, I thank you guys also for making me aware of what was going on at the VA as well, and some of the difficulties that women may be experiencing there, because that's an issue. Because if people don't know that they can go somewhere else, women just aren't going to go,
They're not gonna.
which isn't any better. So
Yeah.
yeah.
All right, that wraps it up. I appreciate you, and I appreciate
Thank
everybody
you.
again. And we'll see you the next time. Have a wonderful and beautiful weekend. All right.
Bye.
Bye.